Doctors and nurses of Reddit, what's the worst thing you've seen on the job? Alright, this one is really, really bad. Like, really bad. Do not read this if you're pregnant, your spouse is pregnant, or you are trying to get pregnant. I'm an EMT, and this is my worst story. Back when I was fairly new to running emergency calls, my partner and I got a call for a woman who was in premature labor and bleeding. We grabbed another person on scene to drive. Since we wanted to concentrate on the woman, we do the usual things: IV, blood pressure, which was really effing high, strap in for transport, etc. This is where things go very, very wrong. While we're on the way to her blood pressure starts to spike even higher, and she's involuntarily pushing. Her entire uterus detaches internally and falls out. Literally. I don't know how much people know about the blood flow required for pregnancy, but when a woman is pregnant, all sorts of veins and arteries are formed attaching the fetus to the womb, and the blood flow to the womb is enormous. So where they're in the back of the bus, everything is covered in blood, like coated. There's a pool of blood on the floor we're splashing in. The mother is, of course, unconscious or dead. We don't even know. The only thing we could do was basically put the womb back in the woman and hold pressure until we got to the hospital. Obviously, neither the woman nor the child survived, and we literally had to remove blood from our rig for 8 hours. The entirety of our remaining shift. It even coated the ceiling. And that's my worst story. Nothing has ever topped it, and I don't think anything ever will. I'm really happy I don't have nightmares, because I know my partner did. My sister, gynecologist, told me this one. Girl comes to hospital, complains that she's unusually smelly down there. Sister takes a look. Sure enough, there is something not right there. Upon further inspection, my sister notices there is an object deep inside her. Sister, there seems to be something stuck inside your birth canal. Do you know what it could be? I'm going to take it out. Patient, no, please don't touch that. It's the cap to my deodorant. I'm keeping it there as a contraceptive. Sister, what? A friend who was a field medic in the army told me this story. While he was in training at a military hospital, they would provide free medical attention to civilians that couldn't afford it on their own. He said that a black woman in her 70s came in with what turned out to be a prolapsed rectum. But that's not the interesting part. When they went to roll her onto her side, one of the guys grabbed her arm and it just flopped freely like it was just hanging on by skin. They freaked and said, "Are you okay? Does that hurt?" She replied, "Nah, that's no big deal. I just have a bad arm." As it turns out, when she was 16 years old, she fell down and completely dislocated her shoulder. They didn't have access to medical attention, so she just lived with it like that for 50+ years. She just conceded that she would never use that arm. He said that it could have been reset very easily without surgery, if they would have taken care of it when it happened. This story makes me so sad every time I think of it. I am an EMT, so not a doctor or nurse, but this story makes even my surgeon friends nauseous. A few years back, I got a call over my radio saying that there was a trapped woman in her home who needed medical assistance. I was the first responder, so I go into the house with my bag and immediately I'm hit by a wall of stench. Now, this odor is not just the, "Oh God, you need to air this place out" odor. It's the sweet mother of God. I can taste it. It's in my eyes. I have to burn the clothes I'm wearing odor. Obviously this woman was some kind of hoarder. There were cats everywhere. They were just sitting on top of crap that had piled up in the house. There was cat crap on the walls, the floor. I saw families of cockroaches skittering around. Disgusting. So I called out to identify myself as a paramedic, and I hear this woman calling me from down the hallway. As I pick my way through the house, the odor just gets worse. It was like someone covered themselves in baby vomit, and then rolled around in a field of rotting flesh. I come to an open door and lo and behold, there is the woman. This woman had to weigh at least 450 pounds. She was naked, covered in crap, and wedged between her toilets and her bathtub. I nearly lost my goddamn mind. The desire to vomit was so intense. I asked her what happened, donned my gloves, as well as a mask, and started to think of how the frick I was going to get this woman out. I'm not small, but dang, I'm not Hercules. It's about this time that more EMTs start arriving, as well as a few cops. This rookie cop comes racing in, sees this woman covered in crap, and vomits right onto her. This sets off a chain reaction. The woman begins to vomit. More EMTs and cops come in, and everyone is freaking vomiting. I'm standing in an inch of vomit juices that is now mingling with crap, and I'm just trying to figure out what to do. Turns out we had to call the fire department, get the jaws of life, and rip the toilet out. We didn't have a stretcher that could support this woman's weight, so we had to improvise. When we got to the other doctors and nurses looked so incredibly disgusted. Now, keep in mind we're covered in crap and vomit, with that horrible odor of the house clinging to us. We had to go into a decontamination room to get cleaned. Worst day ever. You have officially made me so happy I work with dead people and not live ones. Guy came in with severe abdominal pain. Turned out he had painful hemorrhoids which had led to him being too scared to take a dump for 1 month. He couldn't tolerate any of the normal treatment, laxatives and enemas, so he ended up being taken to theater where I, the most junior member of the on-call surgical team, had to claw out this monstrosity of a turd with my fingers. It was this dense mass about 4-5 inches wide that felt like hardened clay and smelled exactly how you might expect a bowl of crap that's been brewing for a month to smell like. Took a good half hour before I managed to clean him out, all while the nurses tried to stand as far away as possible and my seniors peed themselves laughing at my horrified expressions. RN here. Here's my fun tale. Had a very obese man, 400 plus lbs, with a swollen scrotum. No kidding, his ballsack was the size of a basketball, just dangling there between his legs. The gross part was when he went to sit down. Yes, he could walk a few steps with lots of help. He would grasp the handlebars of his walker and start swinging his hips back and forth, to get his ballsack swinging. Then, at just the right moment when his basketball-sized junk was out in front, he'd sit down quickly so as not to crush anything. I pride myself deeply in being able to keep a straight face through that ritual. I never once saw a male nursing assistant who didn't choke with laughter watching him do it. Dad's a dentist. One night we get a call at home from the local asking if my father is willing to come in and deal with a patient because, well, they have no idea what to do with this woman. My dad is a rather stand-up guy, so goes and opens his practice to treat this woman. I go along with him and help set up the room. An ambulance pulls up and wheels this elderly woman into the clinic. From the get-go the first thing that hits us is the smell. Her face is bandaged up pretty well, and we can see blood seeping through the gauze and all down her shirt. Double gloves, double masks. My dad dives in. She has something penetrating her lip. It's mustard yellow, and has the consistency of rock candy. He plays with it a little bit, and a large chunk breaks off. What's attached is 4 of this woman's teeth, or rather, the decayed remains of her teeth. Apparently, this 78-year-old woman had never brushed her teeth a day in her life, and what had penetrated her lip was an obelisk of plaque. He continued to clean away what he could, but the plaque buildup was so massive that she had literally rotten away all of her teeth and most of her gums. One spot was abscessed clear down to her jawbone. To this day he kept the chunk in a jar in his office, and scares little children into brushing their teeth every day. Mom in the air. Guy came in with a pencil and a straightened cloth changer up his urethra, both stuck good. Apparently, the pencil was for fun and the hanger was to attempt to dig the pencil out. I don't understand that method of pencil removal. Saw a lady who had flown in from another country to have US doctors help with her breast cancer. She had a metastatic tumor on her arm that was the size of a bagel and smelled of necrotic tissue. Her chest wall was replaced by tumor and you could see her rib cage. Her family got mad that we couldn't just cut the tumor off her arm. The whole smelled like rotten flesh. Nursing student here. Had to insert a catheter into a pretty obese lady. Saw a black string hanging from her vagina. I asked her if she had a tampon in and she said oh, I hope it's not still there. I ended up having to pull it out and the stench will be with me forever. Not to mention the white pus and brown slime covering a now black tampon. Apparently she hadn't had a period in months, so who knows how long it was in there. When I was doing my OB-GYN rotation, we had a woman come into clinic that had a condom in her birth canal. Apparently it came off during intercourse with her boyfriend, but they didn't take it out, and she waited like 2 weeks to come in to get a doctor to remove it. She stunk the entire office up so badly. Most disturbing thing I can remember in recent history was someone with cysticercosis, tapeworm infection of the brain. I got a script for a Duor with a ridiculously high dose. I called the doctor thinking it was a mistake and he told me what was up. We both agreed there was very little chance of it working, but he said there were absolutely no other alternatives. A homeless paraplegic woman was brought into the ER for pneumonia. We had to strip off all of her dirty clothes and put her in a hospital gown. As I took her pants off, I noticed a cockroach, which I thought was weird. As we took her panties off, out came the swarm. Roaches had nested in her birth canal and she couldn't feel it because of the paralysis. Worked on a rural EMT team during summers off from college and responded to a drunk driving accident. When we arrived, I thought clearly this guy has to be dead, mostly due to the crumpled car that the firefighters had cut apart. This guy must have been drinking a lot, because there were beer bottles all over the place, with broken glass shards all lodged in his skin. But that wasn't the worst part. He had the remnants of a beer bottle lodged in his neck, which in and of itself wasn't too bad. I've seen worse. Except the bottle was the only thing keeping his head attached to this body. The man had decapitated himself. I'll never forget seeing his eyes moving and mouth attempting to speak, or the sick sucking sound that were emanating from his neck as he struggled to breathe. Obviously, he did not survive the night. My mom worked for a urologist. She came home with the story of this guy that had a master lock attached through his dong. He misplaced the key and was looking to get it off. He also rode his bike to the office. They had to refer him to the hospital to remove the lock. Not as gross as some stories I've read, but this is one my mother told me after a night working there. A guy came in with his dong broke sideways. He said my girlfriend got a little too excited. Another one where my dad was driving an ambulance. It was time to remove a cast for a very large woman who broke her leg. He was sent to pick her up. She never got up from her chair since getting out of the hospital. For months she crap and peed herself in her recliner. My mother is the one who removed the cast. The cast was full of cockroaches and roach eggs. They said the ambulance and the exam room smelled for days. Student psychiatric nurse here. While on a ward for the elderly suffering from dementia, I had one experience I will never forget. A lady, let's call her Betty, was in the corridor outside her room. The first thing I noticed were her hands, covered in feces. Oh Betty, did you have some trouble in the bathroom? Hey, it happens. Sometimes when you're older you may be a bit shaky or confused, and I'm not one to judge the unwell. Let's get you washed up then. We move into her bedroom when the smell hits me. For a second I just stare and try to take in what has happened. What follows is my brain process. Traces of feces are everywhere. On the walls, on the wardrobe, on her clean clothes, on her bed, on the door. That's okay, we can clean this. But I can't see any major movement from which it would have come from. But wait, there's something on the floor. As if someone had defecated on the floor and picked it up. Yes, there's slide marks from someone, obviously mauve. Oh my god. She has shat on her dinner plate. I saw, on her bedside table, a plate piled high with feces. I'm not kidding. At least 6 inches on top of the food. And I just stood there and stared for what felt like an eternity. More like 5 seconds I guess, before calling someone to give me a hand. Perhaps it was a political statement about the state of the food in the hospital. I don't know. Regardless, I now have the best party dinner table story. Not mine, but my sister. She was working at an old folks center near our house, and she was with this one older gentleman. On his hip was a black hair the size of a dime, on top of a decent sized lump, about 2 inches long, 1 inch wide and half an inch tall. So she threw on some gloves and squeezed the black head, with the permission of the man of course. Out popped this roll of gauze that was left over from his hip surgery 10 years prior that he never bothered to get removed. Apparently the smell was horrid and she will never forget it. Here's a story from my cousin, who's in med school currently. There was a PCP who went to some part of Africa for the Peace Corps. When he came back, he found he was always more tired than he was when he left for Africa. One day he felt a pulsation in his eye and went to the ER. Once there, the doctor found a small worm wriggling around in his eye. The worm normally lives near the brain, but had somehow made its way out from there and into his eye. The doctor hadn't seen anything like it and called in another doctor to come and look at it. By the time the other doctor got there, The worm had made its way back out of the eye. Cut to about a month later and the PCP feels the pulsation again, but instead of returning to the hospital, he decides to take care of it himself. He takes a needle and heats it up using the stove. He then puts it into his own eye in order to remove the parasite. Over the course of the next year or two, he removes, if I remember correctly, around 5 of the worms this way before feeling better. My mother was once lifting up the folds of fat on an obese person to check for abnormalities and found a biscuit. I found a dead mouse in the fat folds, closest I've been to vomiting. Not a doctor or a nurse, combat medic in the army. A girl came into the clinic complaining of pain in her vag, and when he went to examine her he found she was having thick grey oozing discharge. He tried to prescribe her medication for it, but she refused to take it. Why? Because her boyfriend liked the taste. My dad is a doctor in the intensive care unit. One day he had a lady who was crossing the street when a coach bus ran her over. She was dragged for 2 blocks before someone stopped the bus. She came into the hospital missing like 80% of her skin and was disemboweled but conscious for the whole thing. Girlfriend a nurse. Early one morning a man came in with a broken off plunger up his butt. He was sodomizing himself when it somehow broke off, splintered his sphincter and lodged itself deep within his rectal cavity. Needless to say it was quite gross to remove and looked incredibly painful. A woman came in with complaints of abdominal pain, screaming about how her baby was dead. Her record showed absolutely nothing about her being pregnant. After having her change into a gown, the most ungodly stench filled the room. My doc began a pelvic exam, with me as a standby. I will never forget his face as he removed a pinkish brown clotted mass, a chicken leg. Turns out her baby was an uncooked chicken she chopped up and inserted into her birth canal. Her baby might not have been dead, but that chicken sure was. My roommate is a nurse and there is a homeless guy that comes to her regularly. Apparently this guy had a major surgery in the last 10 years where they removed something from his stomach, or that general area. After the surgery he woke up and just left the hospital without letting himself healing. He proceeded to do drugs such as M and his body was never able to heal properly. Apparently he comes to the ER about once every week to rebandage his intestines. The nurses have to rinse and sanitize the intestines and rebandage him up every time he comes in. They simply take a large bandage and wrap it around his midsection. He has been seen outside the hospital holding his intestines with a plastic bag pressed to his stomach while smoking cigarettes. You have been visited by the fashion doggo comment. Your envy strengthens me so you always look beautiful. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video. Or don't. Either way, have a great day you magnificent people.